West Nile virus detected in College Station. What you need to know. West Nile virus found in mosquitoes in College Station. In a concerning development, the Brazos County Health District, BCHD, has confirmed that a mosquito in College Station has tested positive for the West Nile virus, WNV, as of Monday. This finding raises alarms about the potential spread of this virus in the area. Every year, from May through October, BCHD conducts thorough mosquito surveillance to monitor for various viruses, including West Nile virus, Luis encephalitis virus, and Eastern equine encephalitis virus. Dr. Dennis Nikeliki, the chief epidemiologist at BCHD, stated, "We've been doing a weekly report about mosquito trapping and testing, and this is the first time we have detected positive mosquito pools this year. This positive test result follows a recent human case of WNV reported earlier this month, marking the first instance in Texas for the year where a resident has tested positive for the virus. It's crucial to understand that WNV is transmitted through mosquito bites and not through direct human contact. In light of this positive test, Dr. Nikolake urged the community to remain calm but vigilant. It means we have to be aware that West Nile is a virus, and there's a need for us to protect ourselves and our community," he explained. While it is important to note that 70 to 80% of individuals infected with WNV may not show any symptoms, Dr. Nikolake highlighted that common symptoms can include fever, headaches, body aches, joint pain, and in more severe cases, confusion or encephalitis, which is inflammation of the brain. Particularly vulnerable populations include the elderly and those with weakened immune systems, who face a higher risk of severe complications, including paralysis or even death. In a statement, BCHD emphasized, "Please keep in mind that all of Brazos County should be considered positive for WNV, and residents should take necessary precautions to minimize exposure to mosquitoes." To protect yourself from contracting WNV, Dr. Nikolake recommends several preventive measures. Wear long sleeves and long pants when outdoors. Limit outdoor activities, especially during peak mosquito activity times. Utilize insect repellents that are registered with the EPA. Experts advise avoiding outdoor activities during dusk and dawn, as these are the times when mosquitoes are most active. Dr. Nikolake noted, "Early hours of the morning, that's the dawn, and then early evenings, we see the dusk. Those periods are when mosquitoes are more prevalent and flying around." According to the Centers for Disease Control and Prevention, CDC, symptoms of WNV can manifest anywhere from 2 days to 2 weeks after being bitten by an infected mosquito. In response to the recent positive test, BCHD plans to enhance its surveillance efforts. Dr. Nikelike added, "When we receive a positive poll case, we usually enhance our surveillance, such as spreading larvicide to the affected area and surrounding communities." What do you think about the measures being taken to combat the spread of West Nile virus? Are they sufficient, or should more be done? Share your thoughts in the comments below. Hays County reports first human West Nile case of 2025 mosquito season. Hays County faces first human case of West Nile virus in 2025 mosquito season. In a concerning development, the Hays County Health Department has confirmed the first human case of West Nile virus for the 2025 mosquito season, as reported on Tuesday. This news serves as a stark reminder of the ongoing risks associated with mosquito-borne illnesses, particularly as warmer months approach. While it's important to note that a significant majority, approximately 80%, of individuals infected with the virus may not show any symptoms, about 20% could experience a range of symptoms. These can include fever, headaches, body aches, joint pain, vomiting, diarrhea, skin rashes on the torso, and swollen lymph nodes. Understanding these symptoms is crucial for early detection and treatment. But here's where it gets controversial. The West Nile virus is transmitted through the bite of an infected mosquito, which can become a carrier after feeding on the blood of infected birds. This cycle of transmission highlights the interconnectedness of wildlife and human health, raising questions about how we manage our environments to reduce such risks. Interestingly, the Texas Department of State Health Services, DSHS, has not yet confirmed any positive mosquito pools in Hays County for this season. However, statewide, there have been 272 reported positive mosquito pools for West Nile virus in Texas in 2025. This discrepancy prompts a deeper inquiry into the effectiveness of local mosquito control measures and public health strategies. As we navigate through this mosquito season, it's essential to remain vigilant. Are we doing enough to protect ourselves and our communities from mosquito-borne diseases? What measures do you think should be prioritized? Share your thoughts in the comments below. Hays County confirms first human case of West Nile virus. What you need to know. Hays County has reported its first confirmed human case of West Nile virus, a significant public health concern that has raised alarms among local health officials. According to the Hays County Health Department, HCHD, the positive diagnosis was received on Tuesday. However, due to privacy and confidentiality protocols, the county has chosen not to disclose any details about the individual affected. West Nile virus, commonly referred to as WNV, is primarily transmitted through the bite of an infected mosquito. These mosquitoes become carriers of the virus after feeding on the blood of infected birds, which are the primary hosts. Once infected, these mosquitoes can then pass the virus on to humans and other animals. Interestingly, the majority of people, about 80%, will not show any symptoms after being infected. This leaves a smaller group, approximately 20%, who may experience various symptoms. The symptoms can include fever, headaches, body aches, joint pain, vomiting, diarrhea, a skin rash on the torso, and swollen lymph nodes. For those who do experience these symptoms, the county strongly advises seeking medical attention. While the likelihood of developing severe symptoms is relatively low, it is important to note that individuals aged 50 and older, as well as those with weakened immune systems, may face a higher risk. Severe cases can lead to serious complications, such as stiffness, disorientation, coma, tremors, vision loss, paralysis, and in extremely rare instances, death. The county has also highlighted that severe infections from WNV can result in neurological issues, including encephalitis and meningitis. Currently, there is no specific treatment available for West Nile virus. However, over-the-counter medications can help alleviate some of the symptoms. Patients typically experience symptoms for a duration of 3 to 6 days, but it is not uncommon for them to feel fatigued and weak for weeks or even months afterward. For those seeking more information on West Nile virus or tips on how to prevent mosquito bites, the Hays County website offers valuable resources.